Very good, I very much welcome, as other deputies do, the opportunity to have this debate here this evening. Of course, this isn't the first time that we've discussed this issue in the House in recent months. I welcome the fact that we are having the debate today, but the importance of mental health in the country, and the importance of ensuring that the resources are in place to help those with mental health issues right across the country. I think for far too long, mental health issues were swept under the carpet and talked about in hushed and sometimes, dare I say it, ignorant terms, if they were talked about at all. Bill Clinton spoke on this subject at length on occasion, and he once said that mental illness is nothing to be ashamed of, but stigma and bias shame us all. This is an issue that, of course, does affect us all. The most common and familiar manifestation, of course, of mental illness is depression. Severe depression can cause paralysis not just of the soul but of the body as well. And those who share their lives with victims of depression themselves are also under quite incredible strain. It's a frightening thing to see one of your loved ones suffer from depression or other forms of mental illness. There can be a feeling of helplessness, of no longer being able to reach or recognise the person that you love. My own involvement and that of other deputies across the North East with the Save Our Sons and Daughters organisation, an organisation that my colleague Deputy Doherty would be familiar with, has brought home to me the urgent need to provide community-based services and a community-based approach to mental health in general. And I think it's essential that a strong and positive mental health policy should support not just the patients themselves, but also provide the families of patients with the knowledge and the tools that they need to help their loved ones. And I believe that the best way to do this is through primary care, both through our health service, but also by working with organisations such as So Sad, Aware, the Samaritans and so on. Our support system at the moment, I think we would all agree, is far from perfect, but I believe that many positive steps have been taken in recent years. The era of hiding away, or worse, locking away patients, as Deputy Quaylon said, is thankfully on its way out. The vast majority of mental illness can and should be treated by primary care. Hospital admission should only be reserved for acute cases of severe illness. 90% of mental health problems are now treated at primary care level, and the number of involuntary admissions to hospitals has decreased by over 30% in the last 5 years. And I think this is a credit to the changed conversation that we've led in this country around mental health issues, and a change in attitudes as well. The recommendations outlined in A Vision for Change continue to be implemented, as a series of speakers have said. And we've committed to ring fencing in government €35 million annually to develop the type of community health teams and services that are vitally needed right across the country. It's important too as well that we sometimes remind ourselves of the true aim of healthcare, and this is something that can often be lost on people. The WHO states that health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity, and we sometimes lose sight of that particular focus. I think too often we focus on the illness and not on the well-being. In mental health, as in all health issues, prevention is much better than cure, and I think this is particularly relevant in the case of youth mental health services. I'm glad to see that the HSE is continuing to support and seek to expand initiatives targeted at young people, like the Jigsaw programme that many deputies will be familiar with. Our end target, of course, must be to make this programme and others like it available across the country. And I'm pleased as well that our recently elected President, Michael D. Higgins, has prioritised this area. And one of the first initiatives that he intends to take is to have a presidential seminar, a national discussion around what it means to be young in Ireland today, and I'm sure that mental health will provide a focus for that particular discussion and debate.
Just 1 minute remaining.
Thank you, Laskin Corla. I think this new approach that we have in this country to mental health is a win-win situation for everybody. And a healthy society is a productive society. Critics will quote statistics marking a reduction in percentage spend on mental health, while sometimes conveniently ignoring the successful replacement of outmoded, anachronistic, hugely expensive hospital care with more effective primary and community-based care and interventions that we see in more recent years. And as I stated earlier, our services are far from perfect, but I am proud to be part of a government that is committed to making real improvements in this area and continues to do so. And can I conclude by saying this, Minister, I'm also very proud to be working alongside a Minister of the calibre of Minister Lynch, who gets the mental health issue and who has encouraged us all to take it on and to break down the barriers and speak openly and freely about mental health in our society. This isn't the first time we've discussed this issue in the House, and I commend the technical group for bringing this issue forward previously. We did speak about it at length in recent months, and I know we'll continue to do so. Thank you.
Thank you, Deputy.